Hello and welcome back to the channel. We've got stuff. So I think this one's going to be very interesting. So from my perspective, on the last video we sort of talked about problems with gum disease and how you can try and prevent it. But it's one thing to say brush better or use this brush or use that brush, but actually Alison's brought along quite a lot of stuff. So tell me what we've got here, and more importantly, why have we got it? I mean, electric toothbrushes, and why not just a simple, brush on a stick? Yeah,
so we've got a big range of stuff. So we've got some toothbrushes, some little interdental brushes, some toothpastes, and some different types of floss. So we'll kind of go through each thing and go through kind of the pros and cons of them when they might be indicated.
But what is this? This does not look like a pair of chattering teeth. This looks quite major.
No, so this is one of our dental models that we use to practice on, but we can also use them to demonstrate things to patients. Okay. So quite often in practice we'll use it to demonstrate how to brush your teeth properly, which we'll be coming to later in the video.
Okay, so you say how to brush your teeth properly. We've got a big fancy electric one versus straightforward brush. Does it matter?
So the main thing behind it is technique. There is evidence to say that an electric toothbrush is better than a manual toothbrush, okay, and most of that comes down to technique.
So you could argue that the electric toothbrush is actually facilitating the better technique rather than it being a better thing.
Yeah, because of the way the head moves, because it's always brushing backwards and forwards compared to the manual where you have to physically do the movement. It's a lot easier to get a better result with an electric one.
Fair enough. So what about the smaller square one we've got there?
So this one is one for children.
Okay.
So for babies to 2-year-olds is the age range for this one. So for babies, it's really important that you kind of expose them from an early age to toothbrushes and things like that. So you can get little sleeves that you put over your fingers with little bristles on for when they don't have any teeth, just to get them used to the feeling of you poking around in the mouth. But then you can also just use a toothbrush as well and just gently brush the gums.
Okay. With my little one, my wife has started to get him used to. She will count his teeth, which seems to be working quite well. Yeah,
so this one is really good because of the shape of the head. Because if you can see, it's slightly different in shape to an adult toothbrush.
That's what made me sort of think, hold on, that doesn't look, it's quite boxy.
Yeah, so it means that instead of having to focus on going around every side of the tooth, you can just put it on top of a tooth, and then you've got every side at once, because wrangling a child to brush their teeth is a bit of an effort. So
why aren't adult toothbrushes made like that then?
Good question.
Fair enough. One for a bit of research perhaps.
So we were speaking about how fancy does your electric toothbrush really need to be? The answer is not that fancy. You can get it from cheap, so like £20, to really expensive, to like £300.
That's a lot for a toothbrush.
Yeah, it is. What you'll find as you go up the price ranges is that you kind of get the better technology and more sort of gimmicky things, like Bluetooth.
For music when you're brushing?
So I think the main thing that I've found it links to is the toothbrushes that I've used that have Bluetooth. You can connect to an app, and then you can see the areas of your mouth where you've kind of brushed more and where you potentially need to go back to. Okay,
that sounds interesting.
Yeah.
Is there any feedback from the toothbrush saying sort of, go this way, or?
Not from the toothbrush. With some of them you'll find that if you press too hard, it does light up red, so then you can kind of ease off a little bit. So that can help you a bit in terms of tooth wear, so you're not brushing away all of your tooth structure.
Fine. So I realise you said that the cheapest of these is about £20, but that's still a lot of money for some people. Can I, buy a regular toothbrush and then spend more money on my toothpaste and sort of try to compensate that way?
Buying a better toothbrush would be the better way to do it, because buying toothpaste, as I said kind of in the very first video we did, it's more about the fluoride that's in your toothpaste. So I brought along a couple a couple of different ones. So from your Colgate Total, which was about £3 in Tesco's, to your bog standard Tesco Essential one, which was about 60-70p. The main thing that you need to look for is the fluoride on the back. The rest of the ingredients just kind of added extras.
So in terms of that on here, where have we got that?
It's there, so it's that 1,450.
So 1,450 against 1,450. So being careful here, is it possible you're just paying for a fancy packet?
The higher end ones, potentially. I don't want to get in trouble with any of the fancy toothpaste companies, but if money's tight, buying the super cheap toothpaste will do the same thing fundamentally as an expensive one. The main thing is getting rid of that plaque, that bacteria on your teeth, getting the fluoride onto them to help your teeth remineralise, and keeping your mouth nice and clean, essentially.
Okay.
So yeah, in terms of manual toothbrushes, I can't remember if we said in the first video, but you want to be going to the softer end of the spectrum.
Now, a personal one, I've found when I have a softer bristled toothbrush, maybe I'm lazy, I just have to work that much harder, whereas when I've got a nice stiff wire wool in there, everything's nice and clean. Yeah,
so it can feel like things are cleaner, but with the harder toothbrushes, it's a bit like sweeping a floor. So if you sweep a floor with a big bristly brush, you get off all the big bits, so you get up all the leaves, you get up all the dirt, but then sweeping up the rest of the kind of sawdust that's on the floor is quite hard. But with a soft toothbrush, it's like a soft brush on the floor, so you can often sweep up a lot more of the dust, the dirt that's there, as well as all the bigger items.
See, this is why she's here this often. You guys are just an extra. I'm the one who's doing the learning here. This is fantastic.
Yeah, so it's exactly the same with the softer toothbrushes, and with the softer brushes as well, you're less likely to get that wear of your teeth, whereas with the harder ones, it's a lot easier to press hard and then cause a lot of non-carious tooth loss. So then you're more likely to get things like abrasion cavities, which is just loss of tooth because of brushing. Yeah, because you've brushed it away.
Fair enough, I will. Well, to be fair, I do use an electric toothbrush at home, and I do ease off when it goes red. So I'm not completely in the dark about it, but I did not understand the difference between the soft and the hard. That's very useful. Okay, we've got one more brush on the table here. Your Interdental brush.
Yes. So yeah, so these are, we spoke about them a little bit in the first video and we popped up a picture, but I thought we'd bring them in and show you how to use them in person. So these come in various different shapes and sizes. You can get handles for them, which I'll put on in a bit of time. You can get them in various shapes. If you see your dentist or your hygienist, they will kind of help you out with selecting the right size brush for your teeth. Essentially, they go between your teeth and really clean the gums between your teeth. Because if you're just cleaning kind of the fronts, the backs and the biting surfaces of your teeth, you're missing out all of the area that sits between them. So then that's kind of where you can also get caries developing, where you can get kind of food stuck. So it helps really clean everything out and improve things there.
Okay, great. So we've got a nice selection on there, but a big thing about medicine, science, dentistry, as you know, is it's about the numbers rather than just somebody saying it. So, plain devil's advocate, you've got the training, but we've got the thing. Put your brush where your mouth is. Show us, the difference then.
So I think it would be best if you show us how you do it, and then I can kind of show you how it's done and where you're doing
critiqued. Well. Okay, fine. So how are we going to set this up then?
So. Do you want to start with a manual? I know you don't use a manual.
Sure, yeah, we'll go with the basics of that. You might have to bear with us because we're kind of doing this on the fly, so there might be some random changes when we realise the cameras just aren't quite going to cut what we need here. But we'll give it a go.
So, do you want to show me how you brush in these?
Okay. So we've had to have a brief tech change. So we're going to have a go at, I'm going to have a go at cleaning teeth.
Yes. So yeah, do you want to give it a go at showing me how you brush these teeth?
Sure. Oh, this is very, very bizarre.
Well, yeah, I know it's difficult because it's not in your own mouth.
Okay, so I'm just trying to think what I just shove it in and wiggle it around. So I know that I'm going to want that circular pattern round, and then I'm going across the top, and then similarly circular on at the back, and perhaps trying to get in the side bits. Front, more side to side-ish.
Yeah, looks like you don't really need me. But yeah, so really good job.
Okay.
The things you want to focus on doing are mostly what you did. So you got on the gums, you got around every surface of the tooth. So if teeth have 3 surfaces, so there's the cheek side, which we call the buccal, the biting side, which is the occlusal, and then the tongue side, which is the lingual. So you got around all 3 surfaces of them, making sure you're getting on the gums. So brushing small circles, or you can do small kind of backwards and forwards motions, not neglecting the front teeth. So making sure you're going kind of all the way around, brushing tiny backwards and forwards motion. What you can do as well to add on to this is do a little flick at the end. So you do your little backwards and forwards, and then you do a flick, and then a little backwards and forwards, and then a flick. And then when you get onto the occlusal surfaces, you want to be doing just a good scrub to get everything out of the fissures. And then when you get onto the backs of your teeth, so the lingual surfaces, again, back at that 45-degree angle, small backwards and forwards motions. You can do the little flick as well if you want. And then for the backs of the front teeth, it's hard to get your toothbrush in at this angle. So you want to be going kind of straight up, then just brushing up and down, gently like that. So yeah, so that's how you use a manual brush. Similar way to kind of with the electric one, you don't want to be putting too much pressure on. So if you find your bristles are kind of splaying out loads, or if kind of after a couple of weeks your bristles look like they've been flattened, you're probably pressing a bit too hard.
Okay.
So kind of gentle pressure, 45 degrees into the gum, small backwards and forwards motions.
Gosh, when you say if you've been pressing too much, the bristles will sprat out. Just reminded me, my granddad, his toothbrush used to look like it had, fallen from orbit and hit bristles first. They were just completely splayed and flattened out.
Yeah, so if your toothbrush is looking like that, it's probably time to change it. It's not really going to be doing much for you.
That's fair. That's fair.
So if we go on to electric toothbrush, which you might be a bit more familiar with.
Sure.
Got one at
Let's
home.
give that a go. Other brands of electric toothbrush are available.
Yes. So great. So do you want to show me kind of what you'd normally do with an electric brush?
To be fair, I do think that I'm probably lazy with the electric toothbrush. I think it probably does more for me. Not sure that's going to go with the microphone. So I normally just sort of put it on and maybe watch YouTube and just sort of let it do the work, going round, up and down. I do scrub around the front, but this is what I'm saying. With the manual one, I know that I'm doing the work, whereas this almost makes me feel like I'm getting lazy with it. And then kind of going round, if I push too much, I know it'll go red for me. But the flick that you were saying there, I don't do anything like that at all.
Yeah, so it is a bit of a different technique with an electric brush because it does do most of the work for you. So where with a manual, you do have to do all the brushing backwards and forwards. You don't actually want to do that with an electric one. So because of the way the bristles, because they move backwards and forwards, you want to just hold it on each tooth. So holding it, going around the 3 surfaces, so again, kind of 45 degrees towards the gum, and then you want to just hold it on a tooth at a time. So if I turn it on, so that.
She's pushing too hard. She should see a dentist. Get some proper training.
It's a bit harder on a model just on the table, but you want to work your way around tooth by tooth. With this, you don't want to be doing the backwards and forwards motion because that doesn't actually work with the toothbrush itself. So this does all the work for you in terms of how it's moving. So you want to actually just be holding it onto each tooth for a couple of seconds and then moving on to the next one, keeping it at that 45-degree angle into the gums, and then moving on to the next one. And then again, when you get to the front teeth, you don't actually have to brush it backwards and forwards. You just have to kind of leave it there, let it do its thing, and then you can go back onto the tops of the teeth, still at that 45-degree angle, still going forwards like that. And then you can just hold it again over the tops of the occlusal surfaces, just let it go backwards and forwards, do its thing.
That's the bit that really feels like cheating for me.
Nah, use a toothbrush. And then hold it again on the lingual surface, 45 degrees, and gradually go round.
Just thinking about the way of doing it this way, that way, is it more typical for people to get, you know, the decay or caries on the outside compared to the inside? Because I'd presume that the tongue is actually going to be doing an element of cleaning in of its own right.
It depends on different things. So the most common site of decay is in between the teeth, which is why I'll be showing you how to use the little interdental brushes. And then it depends on a lot of things as to if you get decay kind of on the inner or outer or on the lingual or the buccal surfaces of the teeth. I have seen more people with buccal caries than lingual ones, but that's not to say it can't happen on any surface.
Okay.
So, on the note of interdental brushes.
Here's another one we prepared earlier. It's turning into Blue Peter.
So,
now,
here we go.
I'll be honest, I don't use these at home. I find them far too tight. And so I'm interested to see if... this is exactly what I get terrified of at home. That's literally stuck in there, and then I'm worried I'm going to have to go to the dentist with this thing stuck in my face. These teeth are much easier to clean than mine. These are fake teeth, aren't they?
These are fake teeth, yeah.
Oh yeah, of course they're fake teeth.
But yeah, so with these, pretty good job. So how they work is you want to find ones that are a bit tight to get through, but you're not having to force them through because then they might get stuck. So if they just kind of glide through and you can wiggle them about in the space between your teeth, they're probably a bit too small. So you want them to have a little bit of resistance. So this, for this model, is actually kind of perfect because you want that little bit of resistance, because it means that the brushes are actually, or the bristles are actually big enough to do something, but it's not too big that it is going to get stuck and you're going to have to go to your dentist to ask them to pull that out of your teeth. So the way that's best to use it is you can angle it, because your gums are rounded and this is straight. This is straight. So you can bend it to the shape of your gums. So it's just essentially a fancy pipe cleaner. So you can bend it a little bit with your hands to match the shape of your gums. So you've got your brush that's been bent to fit your gum shape. So just gently kind of push it through the gap. There we go. And then you just want to rub it gently against the gum, making sure you're getting down onto the actual gum and not hovering up just in the gap. So gently brushing backwards and forwards, pulling it out, giving it a rinse, and then putting it back in to the next gap along. Gently brushing backwards and forwards, and then just repeating round all of these gaps.
Yeah, I can see that.
It's not going through. There we go. So you can put it backwards and forwards between your teeth like that, and it moulds a little bit better to your gums, because you want it to be brushing down onto the gums as well.
So we're getting the teeth and then the gums as well. Okay, that makes sense.
Exactly. So that's kind of interdental brushes in a nutshell. You might need more than one size for one mouth. So you might have a really big gap somewhere and need a big size, and then you might have really tight gaps elsewhere and need a smaller size.
Stupid thing, but I hadn't even considered having more than one. I just thought it was like, you know, shoes. Like, I have this size toothbrush. Okay, that makes sense.
So yeah, so if your gaps are really tight, then you can use floss.
Which is what I do, because I don't get on with those. So I use the floss sort of harps, because I always imagine the other one is someone's going to come and strangle me later on with it.
Yes, that's fair enough. So we've got our two types of floss that we prepared earlier. So we've got...
Again, other types of floss are available.
Yep. This just happened to be what was in Tesco's. Other supermarkets are available. Oh my God. So yeah, so we've got the floss harps, which you use, and then we've got bog standard string floss. So features that you want to be looking for in your floss. there are things that you can look
Floss
for in
has
your
features?
floss. Yeah.
Okay.
So waxed or unwaxed is the main one.
Okay.
Unwaxed tends to be a bit harder to get through the gaps because it's a bit more.
It's not got that smooth coating.
It's got more friction. That's the word I'm trying to think of. So yeah, you want to be looking for a waxed over an unwaxed one. The waxed ones are a lot easier to get through the gaps in your teeth because they've got less friction than the unwaxed ones. So it's just a little bit more user-friendly.
It's interesting, because I thought you'd have wanted the friction in order to pick the things up, but I suppose if you can't use it...
Yeah. So you want something that's usable and that works well for you. And the flavour is just... Flavour, yeah. It's of choice. It doesn't really have any impact in the same way that flavours of your toothpaste don't really have any impact either. And then you have the floss harps, which can be quite good if you don't like using the string floss. So can you show me how you use them?
Just go in straight. I push down, and there we go. I have to saw in. There we go. Wiggle it around, and they go, oh dear, oh dear, oh dear. And sometimes I just cut it and then pull it out that way.
Yeah, you do have tight gaps. So what you actually want to be doing with floss is you want to be going down each side of the tooth. So for the floss, you don't want to be going straight down because you'll hit the papilla. You can seesaw it in till it drops in, and then gently kind of pulling it up and down the tooth in front, and then once you've done that one, move it while it's still in the gap to the tooth behind and pull it up and down like that, and then you can just gently seesaw it to get it out.
Fair enough.
And that just helps you get more plaque out.
Okay. And presumably, like dental floss, these are one-go bin.
Yeah, so these are slightly less good for the environment. I think you can get some slightly more eco-friendly designed ones, but obviously they do cost more.
Well, mind you, I wouldn't imagine there's much recycling going on with an interdental brush either.
No, there's not much either. Unfortunately, pretty much everything is kind of made of plastic in dentistry, aside from the odd bamboo thing that's on the market now. But yeah, it's not the most environmentally friendly, but...
Don't get me wrong, I think that we should be doing much more to reduce our plastic load and things like that. But also there are some things kind of like... So I would imagine that there's probably a greater burden ecologically to somebody having bad teeth and having amalgam put in and all of the rest of that. So I think this is probably a reasonable trade-off. Yeah,
I think it's kind of a bit of a compromise. So if you're needing loads of dental work doing, that also comes with environmental costs as well, mainly with single plastics, things like that. So maintaining good oral health is not just good for you, it's good for the environment as well.
Yeah, definitely. Well, honestly, Fine. I did not expect to enjoy this quite as much. I really enjoyed doing the dental myth stuff, but I did not expect to enjoy this quite so much. Well, so there we go. I mean, I say I've really enjoyed this, and I think I've learned quite a lot. I hope this has been beneficial for yourselves. Can I ask a favour? This is kind of experimental for us. If this has worked for you, if you found this enjoyable, put some comments down below. I mean, this has been, a brilliant experience for myself, and that's one of the reasons why we're sponsored by Brilliant for this one, because it is an experimental video. So we want to do something for you guys, but Brilliant have come forth and said that they're happy for us to do a video like this, hoping to bring something to you guys because of actually how Brilliant works. Brilliant is basically an education platform, and I've rejected advertising and things like that before on the channel. The reason why I think Brilliant works really well for this is we've talked about lots of things that you should do and the ways you do it. Everything that we say is backed up when you go all the way back through with randomized control trials or studies or statistics. And when I went to medical school, I wasn't that great at statistics. I had to learn, through brute force learning. But those understanding of statistics now mean that I can read a paper and say to a patient, actually, we should do this. This will help you. And if you're not great with statistics and you're at medical school, A, you need to get better. B, have a look at Brilliant. It's designed to adapt to you and your learning process. So, you know, that maths side of things, where I'm not very strong, you know, Brilliant has helped me get better and certainly polished up my stats. Try everything Brilliant has to offer, free for a full 30 days. Visit brilliant.org via the QR code on your screen at the moment, and you'll also get 20% off an annual premium subscription. So I think that's probably where we'll leave this. I'll say tremendous thank you to yourself again for joining us. Thank you to you guys for joining us, and also thank you to Brilliant for allowing this video to come about. Yeah, take care. We'll see you in the next one. Super.
Thank you. Yeah.